Hi, Donald Jadison joining you for Which Way Your Health, and we're here in Brisbane at the Convention Centre, and this is the 6th Annual National Health and Medical Research Council Symposium on Research Translation, co-hosted by the Lowitja Institute. So we'll have a chat to some of the people involved in that, key stakeholders, and some of the other vision that's happened here.
I feel quite isolated at times from other Aboriginal academics, but for there to be 400 people at this conference is absolutely stunning.
You know, we've got this great program, the Baby One program, but it certainly needs to always be evaluated and made sure that it is giving good benefits for the people who are agreeing to be on it.
It's Dr. McAdams, but most know me as Uncle McAdams. I'm a Senior Research Fellow with the Australian Indigenous Health Infonet at Edith Cowan University.
What do you hope to get out of this conference the next couple of days?
I think the conference is about networking, but it's also about culture and culture translation and research translation. It's also about sharing knowledge as well. And I think one of the things for me is that because there's a lot of Aboriginal and Torres Strait Islander researchers, it's good to make the contact with them. I think over time we should be able to band together and do research together rather than having non-Indigenous people coming in and doing research for us. We work with our people to do the research that we know how to do it, but look at the needs of communities rather than doing research for research's sake.
And does it surprise you how many, the numbers are growing, how many Aboriginal and Torres Strait Islander researchers are coming through at the moment?
It is surprising, but it's also interesting because there's even from medical doctors who've worked hard enough to become medical professionals. They want to do a PhD as well as get involved in research, but they also want to do research with their work and with their patient to make sure that the evidence base is there, the evidence base is clear, and the evidence is there to help our people with their health and well-being.
Do you think research translation and governance go hand in hand?
Yes, to a certain extent. I think research translation and governance, they're both vital. But I think the way that you translate the knowledge is very important. Make sure that not only evidence-based, but making sure that the way you do the work and the way you get results is more about translation, but you have to have good governance to present that as well.
Yeah, and that feeds on to the Aboriginal Torres Strait Islander communities as well, that sort of research?
Well, it's looking at the needs of community, and it's working with people to do that. There's a lot of outside researchers come in and do the research to get results, but also for publications. We need to do research with our mob to make sure that we improve the conditions of the community, but also having safeguards around health and well-being.
What's happening in your community at the moment that you can talk about from a research point of view?
From my research point of view is always been with Aboriginal men. What we're doing is trying to make sure that men are more aware of their health, making sure that they're in a safe environment and have the confidence to go and get medical checkup. A lot of times we get frightened because we find out that something else is happening to us, but I think you've got to work with the men to have the confidence to go and challenge all that stuff and make sure that their well-being. I mean, we're losing too many of our people too young. Like prostate cancer, for example, you waited till you're over 50 before you got examined or went for a test. Nowadays it's 40, 45 because of our health and that. We need to make sure that we're up to date with everything.
Does research help to combat and defeat the black dog that's facing our men?
Well, the research gives us the evidence, but it also gives us the opportunity to sit down and have these discussions that normally you don't have the discussions. So you have these discussions that and brings out all those hidden stuff, the hidden stuff that we don't want to talk about. So it gives them the confidence to say, well, if he's doing it, I could be doing it. And because I've got this, I'm not the only person that's got this. So I need to go and really check up.
So my name is Jo Neville, and I am working in a Poonapima Cape York Health Council, and I'm part of the maternal child health team there as the strategy holder.
What zone do you look after?
So I am a Region 2 manager there presently, so I look after Cowan, Lockhart River, Kowanyama and Pomperau.
How is the maternity rates in those particular areas?
Yeah, so for birth rates, across those four, so Kowanyama, they have the most babies per year, and they're having around about 35 births a year. Pomperau is looking around about 15. Lockhart River would be 15 to 20, and Cowan would have around about 6 births a year. And the babies there, most of them are being born at term, and their birth weights are good. And the antenatal visits, most women there are happy to have antenatal care, and they're having at least 5 antenatal visits before they birth. We have a program at a Poonapima that's a health worker-led program, and that's where it's called the Baby One program. And the Baby One program is a program where the community-based health worker leads this program, and she is the person that has the knowledge behind the program. And what she does is that she invites families to be part of the program, and for families to receive information from her over 15 separate visits, and those 15 visits start in pregnancy, and then they go through until Bubba's 1,000 days of age. And the health worker visits the family at really important developmental milestones of both the Bubba in the womb and then Bub once it's growing up. And part of the health promotion messaging the health worker gives is about teaching families the stuff they already know, but in a way to just confirm for them the best way for Bub to have the environment they need to grow. And she also encourages them to go back for clinic visits so they can ensure that Bub doesn't have a hearing problem, or that baby is meeting milestones as they should at the right time. So if for whatever reason Bub might not be, the baby can have access to early intervention, and so by the time babe's at school it's not delayed in any way, and it can have the best start, because we know that bubs that are in really good health and having all the good opportunities it can when they first start school, it has a really significant impact on preventing chronic disease in the long term, and education is a really important part of that. So the health worker through this program shares lots and lots of health promotion messages and education for families in a way that the families get it, and sort of takes probably the mysticism out of white health world and making it more in a way that the families and community want to hear the message, because it's being told by their own. And I think that's probably the beauty of the Baby One program, is that it's slightly different in every community, and there's a framework there, but the framework will be shared with families in a way that's right for that family and that community, in the way the health worker knows that family needs it.
And finally, what are you learning about this conference, and what do you hope to take away from this to take it back to Poonapima?
Yeah, I think this conference for me has taught me a lot about the fact that for any, we've got this great program, the Baby One program, but it certainly needs to always be evaluated and made sure that it is giving good benefits for the people who are agreeing to be on it, and that if it is to be evaluated, we need to check in with the people who are the end users of it and the community to ensure that they want to evaluate the program and they want to be part of that process. And just because Apuna Pima is a Aboriginal community controlled health service, it's not up to us as a health service to determine the evaluation. It has to be determined by the people who have been part of the process of accessing the program, and I think that's the way the program will get stronger. It will be about the families who have used it in the past and the families who may choose to use it in the future are part of how it will look, and I think that's a really good thing, and that makes me feel happy that I could perhaps help facilitate that process.
My name's Michael Doyle. I'm a research fellow at the University of New South Wales.
First of all, Michael, how have you found the conference over the last couple of days?
It's inspirational. I was a bit awestruck for the first morning, yesterday morning, because in my team we have a lot of Aboriginal people, but I'm so used to being in a predominantly white or non-Aboriginal environment when I go to a conference, and I wandered in it, and you see Sandra Eads up on stage, and you know that the whole conference is Aboriginal and Torres Strait Islander focused, and it was just amazing sort of a feeling to be in that space, because I feel quite isolated at times from other Aboriginal academics, but for there to be 400 people at this conference is absolutely stunning, and to see our leaders in Aboriginal health research up on stage, it's fantastic.
What do you think about some of the sessions, and what they're looking into from a research point of view?
Yeah, very relevant. I realised when they were talking about the difficult conversations yesterday, I identified with those conversations myself, and I had similar things come up, and having things sort of pushed at you because you're the Aboriginal person at times is really challenging, but also the thing of feeling like you're there to meet the needs of the non-Aboriginal researcher rather than being there to further the health of our people and to further your own career and getting that relationship right. And I think they spoke a bit about that yesterday, and I thought a really critical thing too was I think Alex mentioned about people who fail. I'm not sure if it was Alex, one of them mentioned that yesterday, and that we need to take care of those people, but also setting people up to succeed. And so we have people who sort of recruit Aboriginals to PhDs, but you've got to be ready to do that, and you might not be ready to do that, and if you're not and you feel that you need to pull out of doing a PhD, there's absolutely nothing wrong with that, and you should be supported for during that stage, and you shouldn't feel as if something's wrong, because sometimes it's just not the right time for you. But as the panel was discussing in the session later yesterday, that it's just that importance of supporting each other to get through, and everybody can do it. You really and truly can get a degree. It's a matter of just making sure you go to all the classes and hand your assignments in on time, and you basically pass. And so and you can do that. So yeah.
Tell us about your research.
My work is with Aboriginal and non-Aboriginal men in prison. So my PhD, which I've sent the thesis off to the editor, so hopefully I'll graduate sometime next year, which is a strange feeling actually. But it was out at a prison in Western Sydney, and I interviewed 31 men about drug and alcohol treatment programs, and that's sort of one of the first times I think that's been done, particularly by an Aboriginal researcher, and asking the people who go into the treatment programs what they think about them and how they think it could be done better. and it was a fantastic research, and all of the fellows, all 31 of them, the Aboriginal and non-Aboriginal guys, were all really generous with their time and really happy to talk about these issues, and so yeah. But the other thing that happened with that was talking to the Koori fellas, and I'm sort of trying to find the right words here. They were as much researching me as I was researching them, and so they were asking me.
You mean a trust factor?
Yeah. So, and it was a much more even relationship. And I was thinking about this morning. It hadn't really occurred to me until I was here. That I think they felt very empowered in the interviews to if I asked them about their drug and alcohol use, they would ask me about my drug and alcohol use. And I don't know if that's sort of normal for other researchers, or whether it's something that a Aboriginal person being interviewed by a Aboriginal researcher might feel more comfortable at doing, because it's a more equal conversation. And so I'm not sure, and that's something new I had just started considering while I've been here at this conference, and something probably I should speak to some of the other researchers about that. There is a real need to do some work with Aboriginal women around drug and alcohol treatment in prison, and that was one of the things when I set up my project, that I consulted a lot of the community, and most of the women made it very clear to me that this work should be done with women as well, and I've sort of committed that I will help that to happen when I can. But I think our women that are in prison, our fellas have a really tough story, a lot of them, but I have to say I think our women have an even tougher story. Some really bad, serious stuff has happened to our women that have ended up in prison, and so that's really is an important area to do some more work in.
Yeah, and what do you want to take away from this conference?
A hope for the future. I was just talking to Cassie, I think her name was, a minute ago, and she's like 19 or 20, and she's doing her undergrad, and it's like fantastic to meet people who are that age and going to university. I kind of went in at 30, and I've been studying for quite a few years, and at the end of the PhD journey, and I'm like 40 now. But to meet somebody who's like 19 or 20 and to be going straight into this, and so I think that gives me incredible hope for the future, but also seeing how strong and collegial and how supportive we are. They spoke about competition, and that's what's out there in the mainstream. It is absolutely fierce is what they said, and that's been my experience, but it's not in here. Everybody in here at this conference, all of the Aboriginal and Torres Strait Islander, our Maori and First Nations visitors as well included, are all here in a collegial way where people cooperate. And for me, seeing that is really powerful to know that, and to also know that that's the expectations of my community, of the Aboriginal and Torres Strait Islander community. I'm expected to be collegial with my other Aboriginal Torres Strait Islander researchers as they are with me, and it's about, I don't know if I'm explaining that well, but it's about us working together and forwarding the health of the most important people in the research, which is our community. So.
Final question, you have the equality badge on yourself in today's announcement. Obviously 61.6% said yes. What do you think that will mean for Aboriginal and Torres Strait Islanders?
I have never had to defend my sexuality. I'm a gay man, but it's always been my Aboriginal rights, my rights as an Indigenous person that I've always. It's been sitting on the bus and nobody sits next to me because I'm an Aboriginal man. It's been the difficulty of catching a cab because I'm an Aboriginal man, and the vote on whether same-sex marriage should or should not happen was the first time I actually felt marginalised. The gay side of me felt marginalised, and I also thought to myself, is this what our forebears experienced in 1967? And this is only a little snippet of trying to not get too emotional. This is only a little bit of what must have happened in 1967. and how hard that must have been at that time. And that was an overwhelming yes, but it would have been really bloody tough to make that case to be included on the census. And so we have a yes today as well. And I'm really proud of that, but I also think we need to do a lot more education within the community so that we heal as a country, I have to say, because like 61% voted yes, but 39% voted no. And we need to at some point bring that 39% along and say, okay, we respect that you voted no, but that's really not what should have happened. This is not a threat to you, it's not going to harm you or do anything to you in any other way. This is about people being recognised as being legally equal in this country. And I think there is some more work to do in that space.